Hi everyone. I woke up this morning to news of some confusion between Medicare and Medicaid programs. And as someone who has worked for the state of California implementing the Medicaid program here, I thought it would be a good idea to do a quick video talking about the two and discussing the differences between the two. My name is Shrishti Sharma. I am a board certified preventive medicine physician, and I am here to talk about all things screening, all things prevention, and all things health. There are a few state and federally funded programs that provide healthcare coverage to people. The Centers for Medicare and Medicaid Services, or CMS, implements two very large programs across the nation, Medicare services as well as Medicaid services, along with some other federal health programs and services. Medicare is a completely federally funded program that provides healthcare coverage to people who are over 65 years of age or people who are under 65 years of age but who have certain disabilities, including chronic kidney diseases. Medicaid, on the other hand, is a joint federal and state funded program that provides healthcare coverage to people who are low income, to pregnant people, and to children who need them. The way I like to remember it is Medicare cares about older people, Medicaid provides aid to people who need it. Again, this is not an official way to remember it, but I find it easier when I think about it in that ways. As of October 2024, there are little over 67 million people enrolled in Medicare, and there are little over 72 million people enrolled in Medicaid. Some people are eligible for and enrolled in both Medicare Medicaid program. There are about 12 million people with dual enrollment in the programs. In 2023, Medicare spending was close to $1,030 billion, whereas Medicaid spending was close to $872 billion. This represents about 21% and 18% of national healthcare expenditure, respectively. Medicare services are available in four different parts. Part A provides inpatient services, critical access services, skilled nursing facilities, some hospice care, as well as some amount of home health services. Part B provides outpatient care or some of the services that are not covered in Part A. Part C of Medicare services is also known as Medicare Advantage Plan. These are health services that are provided by private insurance companies that are approved by Medicare. And finally, Part D of Medicare services covers prescription drugs. Since 2006, everyone who is enrolled in Medicare are eligible for prescription drugs regardless of their income, their health status, or the amount of prescription drugs they use. So, do you have to pay for Medicare? You have to pay for certain parts of Medicare. Let's break it down. Part A is free for people who have worked for at least 10 years by the time they are 65 and have paid into the Medicare taxes. Part B, on the other hand, is not free. You have to pay a premium of $185 as of 2025 for Part B coverage. The premium can go up depending on your income. For Part C coverage, that is the coverage that is provided by private insurances that have been approved by Medicare, there is a premium that you have to pay depending on the insurance coverage you choose. And lastly, Part D also has a monthly premium that depends on the plan you join. On the other hand, Medicaid services usually do not have a premium, though you may have to pay some degree of copayments or deductibles when you're on Medicaid. For people who are dually covered by Medicare or Medicaid, Medicare pays first into the part of the cost of your healthcare. Medicaid comes in and pays the remaining cost of your healthcare. There may be some services that are not covered by Medicare that Medicaid could potentially pay for. Again, This varies state by state, so you do have to check in with your state's coverage if you are on Medicaid or dually eligible. Obviously, there are a lot of nuances to Medicare and Medicaid that I cannot cover in a short video. But to summarize, Medicare and Medicaid are both government funded programs that provide healthcare coverage to people in need. Medicare is available to people who are older than 65 or people who are younger than 65 but who have some disability, including chronic kidney disease. Medicaid, on the other hand, is available to people who are low income, women who are pregnant, or to children. Through these programs that cost thousands of billions of dollars to operate, millions of people across America get healthcare coverage that they need. And with that, I hope I was able to clear some of your basic questions about Medicaid and Medicare. Until next time, prevent, screen, and continue staying healthy. Thanks for watching. Oh, I do have to put in a disclaimer. Yes, I did work with the state, but none of the information that I'm presenting today has been reviewed or approved by the state. All of the info is my personal knowledge.